Good morning. I want to thank you all for being here. Today, I will share an innovative approach to address a critical public health concern, Kawasaki disease in children. Kawasaki disease is a rare acute systemic vascular disease that mainly affects children under the age of 5. Kawasaki disease is a self-limiting disease that, if detected early and treated promptly, leaves no long-term effects. However, if Kawasaki disease is not treated in timely manner, it can lead to long-term complications and coronary artery aneurysms. The etiology of Kawasaki disease is unknown, but still timely treatment is essential to prevent long-term complications. According to the Mayo Clinic, physical symptoms of Kawasaki disease include fever greater than 102.2 degrees Fahrenheit for 5 or more days and at least four of the following: rash on the central part of the body, enlarged lymph nodes, red eyes, red cracked lips, and swollen tongue or swollen hands and feet. However, children can present with an atypical form of Kawasaki that does not include all diagnosis criteria, making early detection and treatment more difficult. The mortality rate for Kawasaki disease is low. Still, due to the potential for long-term complications, the economic burden of Kawasaki disease is high, extending far beyond the initial diagnosis and treatment. There is no specific testing method to diagnose Kawasaki disease, so diagnosis relies heavily on presenting symptoms. Once diagnosed, the primary treatment for Kawasaki is intravenous immunoglobulin, or IVIG, and high-dose aspirin therapy. Both treatment mechanisms aim to lower anti-inflammatory response. Surveillance for potential cardiac complications include blood tests, echocardiograms, and electrocardiograms throughout treatment. Currently, there are no screening tools in place. Therefore, early symptom recognition and detection are essential to prevent long-term complications in affected children. According to Johns Hopkins Medicine, known risk factors of Kawasaki disease include age, sex, and ethnicity, primarily affecting children younger than 5, male sex, and people of Asian or Pacific Island descent. In addition, Kawasaki disease is more prevalent in East Asian countries, and more cases are present in winter months. Socioeconomic status also has an impact on Kawasaki disease, and according to an article from CJC Pediatric and Congenital Heart Disease, lower socioeconomic status may adversely affect the timeliness of presentation and initiation of IVIG and affect coronary artery outcomes. Despite Kawasaki disease being the leading cause of acquired heart disease, the cause of disease remains unknown. Current research details the etiology of Kawasaki disease stemming from an abnormal reaction to an infectious pathogen in genetically predisposed children. In conjunction with genetics, environmental agents are being examined to identify exactly what causes Kawasaki disease. A study using mouse models suggests that Kawasaki disease is of viral origin through mucosal surfaces in the lung, evidenced by the disease's seasonality and similarity to other respiratory infections. In blood testing of patients with Kawasaki and experimental data from mouse models have generated similarities in the role of IL-1B in pathogenesis of the disease and the therapeutic potential of targeting this pathway. This research is currently ongoing. However, current research still lacks causal clarity. In addition, research is absent for early detection tools, despite early recognition playing a critical role in disease outcomes. And there's limited research on long-term health outcomes and follow-up care. For years, studies have been done to determine the causality of Kawasaki disease in young children. However, the disease remains a serious public health concern, is still the leading cause of acquired heart disease, and the etiology is still unknown. The proposed mitigation technique is a community education campaign that aims to improve awareness and response, education for parents, caregivers, and healthcare providers to promote early detection and treatment to improve overall health outcomes and prevent long-term cardiac complications in affected children. CARE, Kawasaki Awareness and Response Education, will work to educate communities and provide the knowledge and tools necessary to improve outcomes for children with Kawasaki disease. The program CARE promotes a rapid response to Kawasaki disease symptoms to communities and healthcare professionals. Educating both communities and healthcare professionals will reduce delays in diagnosis and treatment, promoting overall health outcomes. The community outreach targets parents and caregivers of young children. It will draw close attention to caregivers of those at higher risk, such as parents and caregivers with children under the age of 5, male sex, certain ethnic groups, and those with lower socioeconomic status. Educational materials that will educate communities on the signs and symptoms of Kawasaki disease. The importance of treatment and support for action will be developed and accessible to all through distribution in schools, workplaces, clinics, community centers, and daycares. In conjunction with education materials, quarterly seminars will be conducted to further educate on Kawasaki disease. Seminars will be available in person and virtual, and educational materials will be created in multiple languages to ensure they reach all populations. A 24/7 hotline will be created and implemented so parents or caregivers can call anytime if they feel their child may be affected and need assistance. Trained healthcare professionals will work the hotline, answer questions, and provide any necessary instruction to these families to promote improved and timely diagnosis and treatment. For healthcare professionals, comprehensive educational programs on the recognition of Kawasaki disease will be created and implemented to assist in reducing misdiagnosis and prompting prompt treatment. A streamlined protocol will be put in place for diagnosis that will include clinical symptom checks, blood work, and echocardiogram referral to enhance the timeliness of the response. There is not a known cause or cure for Kawasaki disease, but CARE provides communities and healthcare professionals to detect, timely treat, and prevent long-term complications of the disease. According to an article by Ramphul and Mehas, rapid diagnosis and treatment can immensely help and improve the prognosis and lower the associated complications of the disease. Through education, CARE provides primary prevention of long-term complications by providing tools to reduce delayed diagnosis. CARE also provides secondary prevention of long-term complications through standardized diagnostic protocols. The early diagnosis provided by CARE initiatives will minimize disease progression through quick diagnosis and action. CARE is also designed to reach vulnerable and at-risk populations to aid in timely diagnosis and treatment. Through accessible healthcare resources and educational materials, CARE aims to address disparities and support equitable care for all populations to improve outcomes for children with Kawasaki disease. Why CARE? CARE addresses the critical gaps in the current literature by promoting education on symptom recognition and early diagnosis and treatment to prevent potential adverse outcomes. The lack of screening tools for Kawasaki and unknown etiology yields the absolute need for increased awareness in communities and enhanced diagnostics and treatment time. CARE fills this gap by providing communities with the tools and knowledge to respond quickly and effectively. CARE empowers patients, caregivers, and healthcare professionals to take action to promote improved outcomes for this patient population and addresses health disparities, ensuring that all populations have access to resources to prevent the long-term complications of Kawasaki disease. The CARE program is designed to be scalable and cost-effective. The program can be modified and implemented in various communities tailored to each specific needs. CARE is a transformative program utilizing education to ensure that every child has the opportunity to receive timely and effective care to prevent serious complications associated with Kawasaki. CARE promotes early action that makes a lifelong impact because every child deserves a healthier future. Again, thank you all for being here today and considering the CARE initiative. With this funding, we can make a lasting impact on the lives of children affected by Kawasaki disease, setting children up for a healthier future. If you have any additional questions, please feel free to contact me at the email listed. And attached are the references. Thank you again.